Apostle and Adalia as well. You don't Adalia for a month.
I've sent it to you. Okay, we are going to start now. Just doing a sound check. A very good evening to you, everyone. So just give me a second, just so that I can do a sound check so you can all hear us nice and clear. So that I can do a sound check so you can all hear us nice. Okay. Thank you so much. If you're joining us on YouTube, a very good evening to you all viewers. My name is Floris Lymon, and I am hosting today on this platform Practical Talk with Floris Lymon. Happy and prosperous 2025 to you all. I know that it's been a while, so I am very happy by God's grace to be back. Please do us a favor by sharing this YouTube link, and I'm also going to be sharing it on Facebook. So please, if you have this link, do us a favor by sharing it, because the topic we are about to discuss is very, very important, and we are here tonight creating this awareness. Wherever you are joining us from, I really appreciate you. Thank you so much for joining. Please do share the YouTube video as you have it and join us live on this discussion, just in case you have any other questions you might want to ask my guest that I have on here today. We want to make the most of this opportunity that we have to discuss this topic. Thank you so much for joining. Once again, my name is Floris. As you can see, I've put a little description about myself. I wear so many hats, so the space on that flyer is not enough. But for many of you that know me, you know that this is one of the things that I do. I create awareness on my platforms. I do different things on my platforms, and this is one of the things that I do. I create awareness on many issues, you know, especially when it comes to health. That's something that I really like to talk about, because I believe health is wealth, and we all want to be healthy. And for us as women, especially, this particular topic that we're going to be talking about today, it affects a lot of us, women and young girls. So I believe it's very important for us to educate ourselves. So I've taken up on myself. This is the month of January. Actually, I did not even know. I only knew about October. That's when breast cancer awareness is always raised. But I didn't know, you see, sometimes just because some things are not affecting us directly, or maybe indirectly, we don't know. I never knew that there was different colors with different types of diseases, about cancer. I never knew there's different months as well, like I said. So, that's one thing I have learned whilst I was talking, to my guest previously before we came on live. My guest tonight, many of you might have seen her on my platform. This is not the first time I've had her, but this is something she's very, very passionate about. My guest is Lady Tina Davis, OBE, OOR. She's the CEO of Cancer UK Salon. For many of you who don't know what that means, Salon is the shortened form of Sierra Leone, where I am proudly from, and she is proudly from too. She's also a female reproductive health specialist. She's a cancer advocate. Like I said, everybody normally has their passion of what they are driven by. And this woman, you can wake her up. I just said to her, last week, she really had to sacrifice her time for us to be on here today. I said, please, I need you. I want to start with this topic. You know, I am slightly related to this topic that we are talking about, and we are women on here. There is no shame about this. It's affecting a lot of people, and I had to bring her in. I've known this woman for many, many years, many, many, many years, even though she turned 50 before me. So
Now you're just telling my age.
she's older than me, but as you can see, she is looking fantastic, you know. Um, it's good to have you, Tina. It's good to have you. It's really a privilege. And I know that many people are going to be encouraged. And as far as this video is going to go, many people are going to be encouraged to take actions where they need to take action, to do what they need to do, the steps they need to take to break everything that needs to be broken, so that we can live as women and we can educate our girls that are coming up. So thank you so much for being on here, Lady Tina. And please say hello to our
Pleasure. It's a
viewers.
pleasure.
So, Lady T, please, for the benefit of many who might not know, what is the meaning? No, before even I go to this, why are we creating this awareness in this month of January around cervical cancer? Maybe for many who don't know what cervical cancer is, this is an opportunity for you to let our viewers know. Over to you.
Okay. So basically, first of all, thanks for having me, and I'm honored and humbled to have been called on to do this talk. Cervical cancer, a lot of people know about it, especially in the Western world, unlike in low-income countries, and the causes, and in terms of governments having screening programs as a preventative measure to cervical cancer. And there's a lot of stigma around it, which is not fair on women, because people think, oh, it's due to lifestyle, which has got absolutely nothing to do with that. So cervical cancer is that when you have cancer, first of all, cancer is abnormal cells that form in any part of the body. So wherever it forms, that area is being referred to as you have, either is a breast cancer, cervical cancer, prostate cancer. So that area has been termed as that's the area you have it. But all of them, they are abnormal cells being formed. So this is abnormal cells being formed on the cervix. Now the cervix, when you get into the vagina, if you have a speculum, you see the osc, that opening there that goes into the cervix. So that's where the cervix is. So if you have a cancer around that area, that is being termed as cervical cancer. So that's the cervix. That's why in advanced countries, we have cervical screening. And cervical screening is done for women between ages of 25 to 45, 3 yearly, where they have cervical screening programs. And for those who are 50 to 64, they will extend it to every 5 years because their risks reduces. And that's why this platform today, it's not just talking about cervical cancer, but to raise awareness, especially for women who are in environments where you have screening programs. If you're being called to screening, don't think, oh no, I'm fine. Oh no, it's painful. Oh no, it's uncomfortable. please go. But these are the reasons why people don't go. Because most women, especially when it comes to Afro-Caribbean women, Black women, women from, say, ethnic minorities, they only go to the doctors when they're ready to have babies. If they're delivering, it's okay for them to just go and baby comes out. But when it comes to anything around that area, such women are very, especially our sisters as well, from Muslim communities that think, they have to cover up, it's sacred. It goes beyond cultural and religious boundaries. What we need to look into, because you think that, oh, well, I can only have a woman respectfully so to those, oh no, only my husband can go beyond certain point. But in actual fact, you do need this test to be done to ensure you're safe and to prevent anything to become, an illness. Because when it comes to, unless it's a very aggressive, it's a very slow growth cancer. That's why in terms of the screening is every 3 years. Because if anything happens, it would not develop into, say, CIN2 or CIN3 overnight. You do the screening, and if there are any abnormalities, which we will talk about what the abnormalities are, then they're, either they do gentle watch, they rescreen to see if your body will get rid of it, or what sort of management they can take before it becomes cancerous. So initially, we talk about abnormalities, then you talk about cancer. So basically, these are the sort of things. But we need to look at the cultural aspect, the religious aspect, why women do, and even the economic aspect. Because women think they have to go to work, they have to feed their children. It's not a priority to go, I'm fine. Yes, you're fine. But it's a preventive measure. That's why they call for screening. Now, in low-income countries, we don't have the pap smear, which is the gold standard that you do. They'll do like see and treat, because they know that when women go, they may not come back. And especially in rural areas. So they go in, do the screening. If there are any areas that are abnormal, put in the citric acid or vinegar in it, they'll see that area and treat it to ensure that these women are safe. And most places, especially in low-income countries, they try to do a one-stop clinic. You come in, you get STI, you get that stuff done, screening, then you go. Because they know transportation, the road, because they are motoring or whatever is location and transportation to that area to come back will be difficult. So women go under the radar. That's why they do everything as a one-stop. So these are all things that we'll talk about in terms of why the screening program, how other countries do it, why low-income countries do what they do, basically. In a nutshell, basically, that's what we'll be talking about.
Wow. So you just said so many things that just I'm hoping that everybody's going to key into this today. So wow. One of the things that I just picked up was you talking about the need for every woman to go get checked up. Every woman to get checked up. Why is it so important for us to get checked up? Or maybe, for example, we know back, maybe for other areas in the diaspora, especially in Africa, the opportunity is not there for like many. So maybe that's why we have people like you. You have your teams where you're creating this awareness, you go into the communities. But for example, here, we have our GPs sending us messages, say it's time to come for your smear test. It's time to come for your screening, or maybe you're feeling a bit funny inside of you, because we need to understand our bodies. Just get up and go and get yourself checked, regardless, just for peace of mind. And sometimes most of us don't, we ignore. So why is it so important for us to go get checked?
It is very important because prevention. We don't have to wait until we're feeling funny. The minute we start feeling funny, it could be something that's gone too far, that we need more advanced treatment for. Although, again, as any other disease, infection mimics a whole lot of things. It could just be a vaginal infection, a yeast, or STI, chlamydia, whatever it is, basically. And even with that, chlamydia, we're having pelvic pains and stuff. So with the cervix, it's completely different, although it might move from that area up in terms of the structure of the female pelvics and organs. But it is very important that people attend their screening appointments. The fact that, for instance, in the UK, the NHS has got screening program is because so many people were coming in with grade 3, grade 4 cervical cancers, and they want to prevent it. That's why the screening program came on, just like the breast screening as well. So these are things these are opportunities that in most other countries, you need to have insurance to get it done. But in the UK, for instance, it's free through the free healthcare. In low-income countries, if there are programs that come in, because I'm not sure there, especially government programs that does this. Most of them are being piloted at the moment. But then you have like the HPV vaccination, which is a human papilloma virus vaccine that's being given to 10-year-olds and above, because to prevent them having, the HPV virus, which would turn into cervical cancer. Because you have boys who have the HPV virus on the penis, and men that will have in the penis, but it doesn't affect them. But when it touches the cervix of a woman during intercourse, that's when it gets transferred there. And when it sits there, that's when it causes this abnormality on the surface. The reason why we have to do abnormal smear, we have to do cervical smear done, or the see and treat that's been done in low-income countries. So in low-income countries, HPV vaccination usually is the boys and girls to prevent both. Prevent the boys from passing it on because they don't get affected by it. But in certain countries, because they only have enough to treat the 10-year-olds upwards, then they do that. With the see and treat, for women who've missed out from age 10 to have the vaccine done, then they will have to have the see and treat. Just see and treat, you come for screening. If everything is fine, bye-bye, you're good, come back in 3 years' time. But then if there are abnormalities there, then that will get treated. And with us in the UK, because we do have the screening program, they have different levels. You can have mild dyskaryosis, moderate dyskaryosis, and severe dyskaryosis. These are all abnormalities. Doesn't mean they're cancerous. But if these ones are not being treated or being followed up, these are what would transform into cancers. If you have a mild dyskaryosis, you get recalled in 6 weeks to have another smear done, then your body actually gets rid of it naturally. Then it's nothing to say bye-bye, come back in 3 years. But then if it persists, if it's severe dyskaryosis, that's why they would sometimes invite women to go to colposcopy. Colposcopy now is a specialized area of gynae where they will have the magnifying glasses, have a look at the cervix and see where they can either take a biopsy or do what they call LETZ, LETZ, which is loop excision of transformational zone, to make sure that all of these areas that's kind of infected or looks different, they get rid of that. And you come back, they follow you up. And these are very specialized. You have to be a colposcopic nurse, a sister, or a consultant gynecologist. Not everyone can do it. But if you don't do it properly, you might just end up kind of lasing the whole of the cervix. And we need our cervixes. So basically, this is what it seems easy for me because I've over 20 years of experience in this area. I just speak about it just like that. But hopefully we'll have some questions that people will ask or they will type it in that we can answer their questions.
Wow, thank you so much. So the screening is definitely important for everyone here, especially if you're in Europe, in this part of the world, your GP sends you a letter. The screening is for 3 years, not solidity. It's every 3 years.
So from age 25 to 45 is every 3 years. From 50 to 64 is every 5 years because your risk reduces. But then even at 64, if you've had an abnormal smear, they can follow you up. Or if you had a history of, cervical cancer and you want to get screened, that your GP can refer you. But the routine screening would not capture you.
Okay. Sometimes some women will have gone for their screening, but something happens after maybe they've gone, maybe year one, nothing happened. In between, something happens. So obviously, if you feel anything and you're not feeling well, if you feel anything, you must go back straight away to your GP, isn't it?
Well, if you're having postcoital bleeding, like if you're having intercourse, then you're bleeding and it's not within your cycle, that's something to be concerned about. Or if you're just bleeding on your part, you're just having Again, we have to be very particular. It could be premenopause or perimenopause. It depends on what age you are in. So if you're bleeding, doesn't mean, oh God, no, it's cervical cancer. No, it's not. You need to know, they need to have a full history of you, do a screening, then they could take it from there. So we don't want to disease monger. We don't want to scare people that, oh, well, you're bleeding in between and it's cervical cancer. No, it's not. But we want to raise awareness and encourage women, especially our Black sisters, Black women. Reason because every disease they go, why is it so bad amongst Black people? Yes, because sometimes we don't take things seriously. Sometimes we think other things are more of a priority than others. By the time we present, it's too, especially with migration, again, cultural, religious, from, country to country, you go from thinking that, oh, where I was, they were not doing that. Or probably there's no screening program on that, or probably it hasn't advanced yet to be talking about that. So if you're being invited, please go. And they will always have, for instance, yes, we respect religious aspect. And if women prefer a female nurse or doctor to do the screening, they can say that before. If you have a family member, they can be there as well. But we always need to have chaperone, because we have to respect every culture, every religion, to ensure that this woman is comfortable where they are, and to ensure that the person themselves doing the screening are doing it in the appropriate way and not being unprofessional. So these are all the things that makes women get very concerned. And whilst they're thinking about it, appointment comes, they skip, and they get to go. But if you just express your concerns when you receive a letter, they'll ensure that provision is being made to at least allay your fears or deal with your concerns.
You're so true. So really, for anybody hearing this, as we are saying it now, actually, once again, we are talking about, where we are in this part of the world. You can request, for some of our sisters that your preference is you're covered from head to toe. That's your culture. But there is room for someone to see you, because you can request that I want a female to see me. I want a female nurse or a female doctor. We all know that there is provision for that. So really, please let nothing stop us from going for that check. Also, Lady T, you mentioned stigma. It's two things. Two things I want you to please touch on. The stigma, and sometimes just the fear of hearing when they even say, we are suspecting that this is it. Let's even talk about this. How can we deal with that? If you go, for example, and they say to you, okay, this is what we are thinking. It looks like it is this. Okay, it's gotten to this grade. I believe that there is hope for a lot of people. It's not like before, as soon as they tell you this, that's the end of life. That's not the case anymore, because there has been an advancement in medicine. And anyway, that's your area. Start.
Well, stigma is a big thing around cervical cancer, because people think promiscuity is the reason why women get cervical cancer, which is not true. You got to think that having unprotected sex with numerous men, and interestingly, even prostitutes, they are the safest, or one of the safest people, because they use condoms, because they know about the risks there. You see. So similarly, like when they say, oh, stigma with HIV, if you've got people being promiscuous or they're being users, that's why they contracted the disease. But the stigma around cervical cancer, people need to understand that it's not because they've had multiple sexual partners or they've been careless in the way they, carry on their sexual life, but women with multiple births. Interestingly, when I was doing my advanced diploma in women's health, that was years ago, and what they said about having a car and a tire, when you have a brand new car, but being on the road constantly back and forth, the tire wears out because of the friction. Equally, so if a woman is sexually active, or they've had multiple births, that's so many children, now that process with childbirth and all of that increases your risk of developing cervical cancer. So it's almost like an erosion of that area. or the gliding. It was really interesting that example was made about a car and tire and a place there. Although a woman is not a car, so nobody should, I'm a woman and a very strong one. I wouldn't encourage anybody to refer to me as that. But it's just an example in terms of the risks. So multiple births does cause that. And some women, if they have in the family as well, their risks increases. So it doesn't mean because the woman is promiscuous, and these are the things. So a lot of women, and cervical cancer, unlike other cancers, is a difficult one. Because when it goes to a certain stage, it's really bad. It's really bad. Because I remember when I was first, I was a senior nurse in gynae before I became a gynae sister. Went to colposcopy, like covering for the colposcopies because I was very interested in women reproductive health. When the colposcopy sister was unavailable, then I had to step in to the clinic, and you saw a young woman whom maybe only had one sexual partner. She had cervical cancer because it was very strong in her family. You see her well-dressed. She was actually a lawyer. But if that's where the health professionals as well, their empathy comes in and their body language. That moment, if I wasn't seasoned or experienced nurse, we would just take you back, thinking like, whoa, what is that? And it's no fault of hers. It's nothing she's done. Just because she's got in her family and a show of bad luck. She developed a disease, and she developed it really badly. Within what stage? He had gone to stage 3, going to stage 4 cervical cancer in her 20s. So we really need to encourage women of color, and all women, because I keep putting emphasis on especially women of color, because I know us. We think, oh, my daughter's got, or my child's got hospital, my child's got this, oh, I will go, I gotta cook, I gotta do this, I gotta do that. The appointment comes, they keep missing it. Because people think it's painful. No, cervical screening is not painful, it's uncomfortable, yes. Going to just lay down, put a speculum in, and that you feel that it's uncomfortable, but it's not painful. Because that's what people think, the pain, or they're gonna probe, they're gonna put something, it's gonna be painful. If they're going to do those liquid-based cytology, it's just a brush. They just put a brush in and do that. So it's a bit, take it and put it in there, that's it. If the spatula, you just go round and that's it. So women shouldn't think it's painful. That's why they can't go. Or you make them bleed, no. Some people, yes, they might have spotting after that, but it's normal. And it doesn't mean that it's going to continue. You can put panty liner, and after a while, but obviously after screening, it's not advisable to have sexual intercourse straight away. And not having sexual intercourse for about 3 days before you have screening done. All that, the sperm in the cervix stays there. So whilst they do the screening, you'll be having sperm there. And you shouldn't just have it when you're mid-cycle, they will not do that, or when you're just about to have your periods as well. They need to ensure that you're not pregnant. Because if they go into the cervix, the os opens, then you'll be at risk of having a miscarriage. And no health professional will want to do that, because I know a lot of women really try. If this is a most wanted child and that happens, it's not a pleasant thing for the woman. So that's why they always give patient information, when to have the screening. And if you don't understand it, go in. If you need an interpreter, go in, let them get an interpreter. And most of, especially in the UK, most of the major languages now, they have all of this information. Read in that, it's been interpreted. But interestingly, most people cannot read the language. They can speak it, but they cannot read it. So if you need an interpreter, don't act like, oh, well, I don't want them to know that I can't read, so I'll just take it. No, ask for an interpreter to interpret it. It's just like Creole. For us coming from like Sierra Leone and other countries, we speak Creole, but how many people can read Creole properly? Very few. How many people can write it? We all do the written one because it's like the social Creole that we can just, but when it comes to literature, that has to be evidence-based, it needs to be done properly. So when you go, ensure that it's been explained to you in the best possible way, in the best language you understand. And don't feel embarrassed that, oh, I can't read English, or I can't read my own native language, that you can't. You were not literate in them. We didn't go to school in them. So don't feel ashamed at all. This is your health we're talking about. And we have a responsibility to take care of our health. And if we don't ask, they won't know. They will just assume. It's so common in every spectrum. Like you go there, they give you a leaflet and all that. Everything is on internet, thinking that everyone is technology savvy. Everyone can go online and look at information. You can look at information, but can you understand it? Can you interpret it? And this is where our whole system, especially in the UK, goes wrong as well. They think, oh, it's online, they just send you a letter, and that's fine. No. And I think it goes back to a typical British or English thing that everybody around would have gone through that. But looking at migration and different ethnic minorities now, because it's a multicultural society. But they will not make information that will cover every culture, will cover every language. But you have to request. And you need to say what your limitations are. If you don't say, you don't get.
Wow. Yeah. It's all about speaking up.
Absolutely.
Somebody mentioned just now on the YouTube, I think it's when you were talking about getting seen early on time. So we are talking here about, prevention. And we all say this.
Prevention, absolutely.
Prevention. Yeah. She mentioned one of us, celebrities that we used to really enjoy when she was in Big Brother back in those days. Blessed memory, Jade Goody.
Oh.
It was so quick.
Mm-hmm.
It was so quick from the moment of diagnosis, by the time you think, and these are some of the things, please, ladies, as I have, my sister here today. She's speaking from her heart. This is something she sees on a daily basis. And we are just here, to encourage as many of us women not to wait till it's too late. We know we are not the owner of our
Don't say it
lives.
won't happen to me. Oh, I'm taking care of myself. It won't happen to me.
Yeah.
Don't say that. Take the opportunity. Get yourself your pap smear done. Your screening, each time you get your appointments, each time you get your invitation letters, ensure that you get it done. I know, especially women who've never had any heterosexual relationship. A woman has never slept with a man. They are gay from onset. They're virgins as well. Women who are virgins will opt out of the screening program, saying that I'm not sleeping with a man, I'm a virgin, I don't see why. Those are exempted. But if they want to, they decide that I don't want it done at all because I'm not being sexually active, I'm not sleeping with a man, I've never slept with a man. Yes, these are exceptions that they will say, okay. Some they will still receive the invitation. That's why it's called invitation to attend. Then I think sometimes, just as we do with our prostate cancer, looking at discussion and see with ethnic minorities, what would be the language? So invitation. So when you're invited, I don't have to. They say I'm invited. I could say it's like going to a party. I'm invited. I don't feel like going, so I don't go. But when you start using certain language for certain ethnicity, because that's how they communicate. When you say that you strongly advise people to attend their appointments, you advise people to, as opposed to saying that, oh, you've been invited. So if you invite me to a place, if I don't feel like going, I won't go. But the language as well, hearing to certain cultures, they have to look at to ensure that the people understand it. Because when you say that, just think, oh, well, it's just an invitation. It's neither here nor there. But then that's the, what I would say, colloquial way or the English way of saying that invitation, think that you opt for it. But then looking at all the cultures, what you'll say, whether it's an invitation, but you strongly advise them to attend the appointment. Just that line, that will be there. Even if they put it in caps or in red, for people to look at it and think, oh, well, it's in red, means that's really important. I have to go. Some of us need a push.
Yep.
So these are the languages, the stuff that the healthcare system needs to look at.
Yep.
And not just translate in different languages. Even those who can read, they'll say, no, I'm busy. Oh, I'm tired. No, I can't be asked. It's just an invitation. It doesn't matter. But that one invitation that you will miss, you don't. But the next time you decide to go, there might be something there that if they had captured it 3 years earlier, you would have been fine. You would have been about your business. But because you missed 3 years invitation, now it's being caught late. It means they have to go through radical treatment, drastic surgeries, which you could have prevented earlier on. That's why the screening is a preventative measure to ensure that if it's anything wrong, it gets caught early.
And the
So
reason why, thank you so much, Lady T. And again, what you're saying here, this is not only about us. Most of us have girls growing up. Most of us have teenage girls. We have young adults. Again, we are watching out for ourselves and we are educating ourselves so that we can encourage our young girls coming up. Or you can have a niece, you can have other women in your family, because we are being aware. It's easier to pass that on to others. I was going to say, what are some of the symptoms to look for? Because you did say for us to remove, the notion of, the scaremonger, just when you feel something, just like when you talk about breast, any slight thing that you're panicking and stuff. But at least it's better if you notice something to go straight away. So if they have not called you yet, but you're noticing some certain things, what are some of at least the common known symptoms? Because some symptoms, they don't pop up, they don't show. So are we saying whether there are symptoms, you're seeing it, or even what you don't know, the moment you start sensing, at least just go for peace of mind?
Yeah, you need to. In terms of cancer care, we always say don't wait until you have symptoms. If they have screening program, I'd be invited to go, because the invitation is from age 25 in areas like the UK. So when you have that invitation, say maximum by the time you're 26, you would have received an invitation. But if you're having discharges, offensive, you have your bleeding, which you're not between your cycle, but we have to make that clear, because bleeding is normal for women. If you're not at the end of your period or about the start of your period and you're bleeding, these are things that if you're having postcoital bleeding, each time you have intercourse, there is bleeding. These are the things you get to the doctor for. What they will do is that initially, if there is no blood on there, at the time that you go, they will do HVS, which is high vaginal swab, to check for any infection, and they'll do chlamydia swab as well. So if the chlamydia and that's come back and it's fine, then they might think, we assure you. Or if there is a need based on history, if there's need to have a screening done, a smear, then they will do that. So you don't have to wait. If you're having symptoms of discomfort, there is discharge, offensive discharge, discolored discharge, bleeding, postcoital bleeding. These are things. And postcoital meaning that after sex, you bleed. Or whilst you're having sex, you're not on your period, you're not due, and you're bleeding. These are things you need to go to your doctor for. Ensure that. And you're never too young, because people keep saying, okay, the screening is 25. They think, well, usually, they don't start having intercourse that new. But our kids are growing up. Our girls are, really, this talk should be for women and girls. And even in terms of the HPV vaccination, that some parents opt out for that. Parents don't want their daughters to be vaccinated, because again, it's the stigma around it. The lack of knowledge, thinking that, well, if you're vaccinated about, it means that you can go on having sex. So it's not preventing pregnancy, it's not a license, but then if they're having vaccination, which is a program, please ensure your daughters get this vaccination. In areas where they have enough vaccines, let the boys be vaccinated as well. Because
you have rare cases, isn't it?
Well, no, the boys will have the HPV virus on the penis. It doesn't affect them, but when they have unprotected sex with a girl, during ejaculation and all the semen, all of that, then they will leave it on the cervix of the girl. That's what was developed into abnormal cells.
Wow.
But they don't have any symptoms, and it doesn't affect them because they don't have a cervix, obviously. So we need to encourage our girls to, practice safe sex. And safe sex doesn't mean that being on the pill is preventing pregnancy, but it doesn't prevent any STIs or any other thing. To use condoms, basically. They could have implants, although they look at the stages now anyway, because people who are, preventing, like family planning and say sexual reproductive thing they have is completely different. So you can have contraception and family planning. So in terms of contraception, it's for young people. or unmarried people, make sure that probably if you have a steady partner and you know that the partner is not, doesn't have another partner or doesn't have another partner, because it's a vicious circle, then people will say, okay, I just got my pills and I'm good. But if you're not sure about your sexual partner, then condoms are the best, really. When it comes to women who are married or into a long-standing relationship, that's when you talk about family planning. Because everybody says, oh, I'm a family planning, but then when you have a family, that's when you plan it. So it's contraception, basically. And the most appropriate or the most recommended when it comes to that for young girls are condoms. Because you can prevent pregnancy, but you cannot prevent STIs, you can prevent chlamydia, you can prevent HIV and all of that sort of things. So there is a lot around that. I think because of all of this, that's why the stigma around cervical cancer is people think, oh, well, because you've been promiscuous, have multiple sexual partners, that's why no. Some people have only had one sexual partner, but they've just been unfortunate and it happens to them. So we should not stigmatize anyone, and the conversation around this. So it's January, which is cervical cancer month, but the conversation should carry on year in, year out. It's not just in January. We need to keep having this conversation, keep educating our women and girls about cervical cancer. And in areas where they have the HPV vaccination, encourage parents, because you need parental consent for that. Encourage parents to consent for their children to have the vaccination, because it's preventing them from developing cervical cancer. Again, it's not a cure, but it's a prevention, because out of 100 girls that probably be, vaccinated, maybe 2 or 3 end up with cervical cancer. But again, that's a massive reduction in incidence. Because no matter what, there's nothing that's 100%. Even the contraception we take is at 99.9%. There's a 0.00% or 1% that would be at risk or might end up falling pregnant with contraception. So we just need to know as women how we bring in this conversation. And I think that we should be having tea parties to talk about cervical cancer, breast cancer, and even bring our men on board to talk about prostate cancer, because women play a massive role in that. Yeah, so the conversation needs to keep going. And I want to see questions coming up,
Yeah, so please, if you have questions whilst we are talking. Oh, thank you. Thank you, Lady Victoria. Thank you, Lady Jane. Thank you, Lady Naomi, Lady Martha. Thank you, everyone joining us on Facebook and YouTube. Please, if you have any questions, can you please put it on the chat? This is not a time for us to be ashamed. Or you can send me the text personally if you have my number, and I will send the question to Lady T. Lady T, you were speaking about this vaccine. I know, for example, I work in a school, and we have times when nurses, the NHS sends nurses in for girls. Again, you just touched on it. Again, because sometimes parents are just not aware. They go, oh, why are you going to put inside, that person's body? And by the time you think, we are talking about hormones, because everybody's body is working differently. Some people are catching, unfortunately finding themselves in this situation, even at a young age, just like, the menopause. Some women are going into menopause at such an early age. So please, even as parents, let's do the needful. Let us please do the needful, just to help, so that we are all in a better place. Because as we speak, I know there are women who are going through this particular type of disease right now. I was sharing my story earlier on that I almost had a scare. Many people did not see me for a long time. People didn't see me online. But people didn't know what I was going through. you know. Many people, for all they know me for, I pray, I'm a pastor, I'm a this, I'm a that. But sometimes you just don't know what other people are
And
going
a
through.
teacher.
Yes.
Don't forget that.
Yes, and I almost had a scare, but I am thankful that I was able, like you say again, early prevention. I think by God's grace, I'm not better than others, but by God's grace, the moment they say, oh, you need to come and do this and this, I backed it up with prayer. I didn't leave my prayer behind. Again, please, because many of us, we have lost our lives. Do everything you can do. The Bible says, haven't done all what you can do, then you continue to stand. What do you have to say for many people? We are having this again just for anybody that is going through this, for you to know that you are not alone. We are sending you hugs, and for you to know, please talk to someone.
Is it going to you? If you're
Yes.
going through any difficult time,
Yeah.
we're here to support.
Yeah.
And I always say, I'm not just an advocate, being a specialist as well, and a psychosocial expert. Sometimes what's going on around us makes it even worse than the diagnosis. So if you find yourself in that, there is Macmillan, there's cervical cancer organizations that you can look up and just call. There's NHS Direct.
Or anonymous.
Somebody, anonymous, just speak to somebody. I would not put my contact on there, but on Cancer UK Salon, we have an info at canceruksalon.org. Just whatever it is, we can reach out to you and see how we can support you, because sometimes we feel alone, and that's a very lonely place to be, a very sad place to be when you're going through something and there is no one to talk to. And we do know that people go abroad as well. They, leave their children, their partners, their families out, away in their home countries. They're there alone to work. They're there for economic reasons. They haven't even got a support network. And that's where women's groups as well, churches, mosques, social networks is very important, how we can support our fellow women during this, trial times. And even you don't have to wait until you say you've been diagnosed with cervical cancer. No, try to connect to your surrounding, what's happened there, because we all need a support network. Say, we don't have to wait, because when I used to have an Irish friend who became my boss at one time, she goes, when you are discombobulated with all of these things going on, your social thing, your economic thing, now health, you don't even know where to turn. You just close your door, you stay in. You don't know what to do. Yes, initially you cry. Yes, it's nice to let it out on your own, but then you need to speak to somebody. Even if it's your GP that you call your GP, tell them you need to speak to somebody. There are counselors around. The practice nurse, most of the time, they're very busy doing different things. They may not be able to see you, but they can make time for you or refer you to some particular person or place where you can get the support that you need. And you need to, after crying, which is good to cry, after crying, then you look, what do I really need? Where am I crying? Who do I need around? And study organizations does help as well. But if you're going through this and you're alone, the support mechanisms that you need, if it's your partner, your child, your family member, how they can join you where you are to support you. We know the immigration laws are difficult, they're getting more difficult, but there are ways that they can support you. There are charities that could bring, somebody can come to your doorstep, somebody can phone you to see how you are, to show concern about you. So don't think you're alone, because you're never alone. And being a lonely person or feeling alone is a very lonely place to be.
Yeah.
Because the first thing that goes to your mind is death. You hear the C word, that's what was called before. People never used to even use the word cancer. They just said the C word, the big C. You got the stigma around it. The first, but you look at survivors. I have a friend who I met at the in Geneva last year at the World Cancer Congress, the International Cancer Congress. She's a survivor of cervical cancer, and she talks about it. I met another friend who is on TikTok and all of that. She's a breast cancer survivor. She's had bilateral mastectomy. She goes on TikTok, topless. Look at her scars, but she's alive. You look at all of these. These are really inspirational people that can support you, help you go through difficult times. And they're all part of the cancer network, you see. So women don't need to feel embarrassed, feel ashamed. I know certain communities are very close. You don't want the next person to know what, but if you don't want to speak to your closest friend, there are professionals you can talk to who can give you the right kind of support that you require. So please, ladies, and girls, listen to this as well, that, Know about this, talk to your friends about it. Friends who are on pills, because we know now, in terms of the age, sex age 16, they start, 18, consensual, as long as it's their age mate. They might have this boyfriend for a while and get to another one, and the boy probably sees somebody else. So we need to have this conversation with our children.
With our children,
They're
yep.
never too young to have this conversation. They need to know that these are risk factors and what they can do to reduce these risks. Because it's all about risk reduction we're talking about. It's not about saying, oh, when you do this, you wouldn't. It reduces the risk. But then when you get to that age, they're going to be called for screening. Then you make sure that each time you have this invitation, you honor it. And that's an opportune position we are in. Because people in low-income countries are looking for opportunities like that they don't have.
Yeah.
So if you have this opportunity in advanced countries in the UK, when you have this, please grab it, run with it. Even call them to say, can I come earlier? I cannot come tomorrow because I'm working, but can I come today to your GP? If they have a slot, they'll accommodate you. Just contemplate your challenges and you get sane, because at the end of the day, prevention, prevention, prevention.
Thank you so much, Lady T. I was just about to say you touched on something which we have to talk about. Now we've spoken about us who are here, and we have all these privileges that we need to make use of. At least there is intervention if we put ourselves out there to receive the help. And we are talking about Africa. How are our women coping? How are they coping? What's available for them? Because I know you touch base in Sierra Leone all the time to support these campaigns, to support these communities. How are women coping back home?
Well, I'll say it's not just Sierra Leone, in Africa in general. West Africa, I can speak for that, and other places. The pap smeared are for, what we say, the privileged women who knows, who can pay for it, go to laboratories, go to the gynecologists, advance, have their pap smear done, get the result and stuff like that. But for the underprivileged women who are in the majority in low-income countries, it's a see and treat. That's why it's like a one-stop. Because you come in, if you have discharge or your history, going to clinic, what they do is that they can do swabs, they do, it's like a colposcopy, but in a different setting. They have scopes, they look, it's a see and treat, basically. You come in, they do screening. Screening is one thing. And if all is well, they said, well, the cervix looks fine, you can go. But once they put the citric acid in or the vinegar, they realize that there are changes. Then they will have to either burn the lesions that are different, the changes that they see, and you go, and they will give you an appointment to come back. But most women don't come back, as I said, because the roads are not roadworthy, transportation, they cannot afford it to come back into cities. So most of the time they take the services to the women, and the screening programs, after a while, they'll come back. They're not statutory or stationary in that particular village. So women need to be, first of all, stakeholders consultation, involved in Mommy Queens, the women around that, the female leaders in the community to say, this is what we're coming to do. And educate them first, to educate their women. Otherwise, you can go with whatever program the women will not uptake because it's not part of the culture. And we're trying to change the behavioral change you're trying to create, to know that it's not just when you want to have babies that you go see the doctors, or then that's when you can lay down, somebody examines you. No, but there are other diseases that affect women, like cervical cancer, that early detection saves lives. And if you have a child, you want to see that child grow. These are the measures we have to take to see that child. But if you have a disease, if you have cancer, for instance, or say dyskaryosis, a change, if it's not been looked at or been treated, you may not live enough to see that child grow. Because women, we are very attached to our children. We want the best for our kids, and we want to be there when they graduate, when they get married, with all the beautiful things. We want to see grandchildren, you see. So these are the situations. They go and they have all the see and treat done in communities. Because when they get that done, they do it in a health facility. If after they've done a centrate, if they have any bleeding or if they can go back there and meet their nurses, the CHOs, who can further manage that. Because these, as we say, these are activities, it's not just stationed, which is stationed in the little villages, because it's like from top to bottom approach. And you can't just say, oh, the cities. No, most of the time, the people that live in these impoverished communities, underprivileged, they need these services too. How you take it to them, what the communication is, how they receive it, and make sure they uptake it is another thing. So women out there, that's why initially I was like, and especially for me, I would say I'm very conversant with modern medicine. So when it comes to tropical medicine and how things are being done in say underprivileged or low-income countries, I wasn't familiar until I actually, found that this charity, started working in this charity, and I realized even for breast cancer, I kept saying, oh, because the surgeons are all men, that's why they just remove the breast. That's not right. Because if the breast is, of a good size and the size of the cancer is small, they can get a clear margin, just probably radiation. Obviously, there's no radiation, for instance, in Sierra Leone, there's no radiotherapy. But when we had prostate cancer work, which we were privileged to have the president and his wife, the president made a policy statement that the government is trying to get immunotherapy in country, which we're going to follow up and hope that, it happens. So in terms of, mastectomy will be a thing of the past. They can do, just kind of a lumpectomy, get a clear margin, and have a radiation around that area, and women can keep their breasts. But initially, I was thinking that, why do you have to do that? And they said, well, we don't have immunotherapy. So if a woman's got breast cancer, now if it's a good size, if you don't do mastectomy, they keep coming back and, for that, and they don't have the money. But mastectomy means that breast, as long as it hasn't metastasized, hasn't gone to the bones or anything like that, so the chest and all, then they are safe on that breast. So similarly, that one-stop clinic, women come in, they will get their, so it's first of all, it's screening. They're going to go and burn lesion. They screen using the vinegar, citric acid, have a look on a microscope. If all is well, then you go. But then abnormal cells, if they look at certain areas are not smooth, they're abnormal, then you can do that. Again, women will say probably that's how the cervix is, because they don't have any image of them. Like when you say mammogram, you have a baseline mammogram, you get recalled if they don't know what, because you might be just probably you got involved in a traffic accident and they pulled you, have that, and they will see it on the mammogram. But when you go give a history, they say, okay, your history and that corresponds to what we see. That's just a further imagery, and you can go home. With the cervix is different. So if you've been having myeloscoliosis, they just follow up, 6 weeks, you come back, your body gets rid of it. But again, just touch on that. Women with immune compromised. So people with HIV or other diseases, for the immune system is low. So even having a low, say if you're having a myeloscoliosis, they have to follow up. Unfortunately, when it comes to any disease that comes, it compounds on what's already existing. And because of existing situation, it makes every disease that you end up, I don't want to use the word acquiring because you don't buy it, but contracting or developing, it's mostly severe than a normal person or somebody who doesn't have any underlying conditions. So that's why we really need to encourage our women. And most women don't know their status. But the good thing is that most of the time, when it comes to maternal health as well, looking at pre-assessment, going to antenatal clinics, HIV, hepatitis, these are routine screening that they do. Routine screening, because if you see that, then obviously your mode of treatment is different. Because even in terms of delivery, you have to protect the child and ensure that you have a normal delivery, cesarean section and stuff like that. So when you go to hospitals, then you know. But in our communities, yes, there are all these policies, there are all these guidelines. But how many women even get one ultrasound during their pregnancy? How many women that even goes to see a gynecologist? It's not, it's something that we have TBAs, which are traditional birth attendants, whom they have tried to abolish. So train them to support midwives and stuff. In most communities, there are TBAs that deliver babies. And most people will say that it's a neighbor who was a TBA, traditional birth attendant, that delivered me, not a midwife, not a CHO, not a nurse midwife. So this communication, this awareness goes way beyond looking at in sophisticated environments. You see. So in low-income countries, there's a lot of challenge, and that's why we keep banging on that for us, that yes, we are where we are, and we shouldn't take that for granted. But we try to support women or the community, men in other environments where they don't have all these opportunities that we are exposed to, basically.
Wow. Thank you so much. There's a question. Someone was asking, and that's something again that I did relate to. So if you've had, especially in your direct family, what's the term? What's the term? Genetics.
Okay,
So for
genetics.
example, the mother had it, or your sisters had it, or you have that kind of lineage. What do you do? Because, for example, my mom, well, again, this was in Africa, so we don't really know, but my mom's diagnosis was ovarian. So the moment after the funeral, we came back to UK. Any little thing I felt in my stomach, I said, I am not joking. I went to get myself checked, and same with my sister. We had to make sure we cannot be careless, because if something has killed my mother like that, then we need to watch out. Not that it was out of fear or anything, but it's good, again, we are talking about precaution. So so that question, really, some people might be dealing with that kind of situation where, okay, if close family members have had a similar experience, what do they need to do?
So in terms of family history, that's what you talk about, genetics. If you have a very strong family history, your doctor needs to know about that. So the routine recall, the thing is that it puts you probably at a higher risk of developing the disease, but then there might be somebody who's never had any family history at all.
Yeah.
Disease, and you don't. But what you can do is that the routine, that's why it's called routine screening, is 3 yearly. If you're within that age frame of 25 to 45. But if you have a strong family history of that, you'd let your GP know, then probably they can do it earlier than normal. But all of your screenings are fine that you've done. It's something for the peace of mind, your GP can say, okay, instead of coming 3 yearly, which is the routine one, probably they can do it 2 yearly. But if you have any symptoms at all, you can go in, then they can do your screening. If you're concerned about anything, they can get you screened. These are soft. Again, it's all about communication. Because if things are going on with you, you know that you have this history, and you just, because of fear of bereavement, fear of disease, you don't want to take cognizance of it, thinking that, oh, I'm going to go down like my mom, like my aunt, like my grandmother. You're not your grandmother. Genetics don't play, but it doesn't mean it will happen to you. It increases your risks, but doesn't mean that you will. If you have the screening invitation and have a discussion for that peace of mind, you can go more frequently than the 3 yearly, but that will be discussion with your specialist. I wouldn't say that this is what they will do or whatever it is, but based on your family history, then the doctor will decide that, okay, come every 18 months or every 2 years, or yes, you have a family history, but you're not really at a high risk based on the person. Family history, was it first line, family and all of that, looking at genetics? Okay, yes, you have that, but you're not at a first line or whatever it is, so you don't need to. And as we say, cervical cancer, again, it's a slow growing, unless you have a really fast growth.
Aggressive. Yeah.
Aggressive one, that's when you think that within 3 years it would have gone to whatever it is. But within that 3 years of your first screening, if you have any concerns, any discharge, any postcoital bleeding, any intramenstrual bleeding, whatever it is that's happening, you need to get back to your GP, let them know so they can keep an eye on you or do another screen to ensure that you're safe. So don't just think, oh, well, it's every 3 years, so that's fine, I'll just wait. Don't wait.
Yeah.
Any symptoms, get back to your doctor to say, I've had my screening not a year ago, I'm having these symptoms. Even for those who don't even have family history, but what they would first of all do, they would do a HVS, which is high vaginal swabbing. They would do a chlamydia screening. If you're sexually active of that age, they can do that. Then they do the rest of them. But ensure that it's not within your cycle, because they can't do it if you're bleeding, because they don't have enough samples. Then you have to keep coming back and come as insufficient samples and all that. You don't want that, because it creates more anxiety. So you need to do that out of your cycle, out of your bleeding period.
Wow. Thank you so much. Thank you so much, Lady T. I think we've touched, the time will just never be enough. But
I
I
know, right?
believe, and it's gone so quick. I think because it's your area and you're just delivering like drinking a glass of
Well,
drinking a glass
that's
of
what we call a
water.
specialist. So, we need to keep having these conversations and even with me, even with specialists, the more they do it, the better they go. Every time you have different questions and stuff like that. Yes, protocols change all the time. Yes, it's the same cervical we're talking about. It could be the same disease, but things change. And we don't have the same audience all the time.
Yep.
So you might have somebody that missed it before, but they
Yep.
come in, and this probably will be somebody that's vulnerable. You don't
Yep.
know, as somebody that's
Yep.
of high risk. That's why I keep saying that, like breast cancer, it doesn't have to be October month. No, you can talk about it any time of the,
Yeah.
This
It's
is
affecting people
all
every
the
day.
time. It's every day. Cervical cancer, not just in January or World Cancer Day. Let's pick a cancer to talk about. No, it's a conversation. Let's, a girl's talk that we need to, for our, even mothers can sit with their daughters and listen to this. Go on YouTube as well, just to get information. Although, again, when you go on social media, there are too many experts there.
Yeah. You have to be careful what we consume.
Dr. Google, and people talk about their personal experiences, but they're not talking from a professional point of view. And people misunderstand what they had. People may have maybe dyskaryosis, had less, and it was fine. They say, oh, I had cervical cancer, I had treatment. No, you had abnormal smear, abnormal cells that got treated before it became cancerous, but they will claim they had cancer. And they will give you, yes, it's nice to give you experiences, but if you go for that, you don't go into professional platforms, you might get some misinformation. They'll be given, with all due respect to their personal experience, which they're entitled to give. But when it comes to that, they know about the diagnosis, unless if they are patient or survivor advocates, they've gone through that and they understand what they're saying, they're in the position to give certain talks and talk about what, even that they wouldn't talk as professionals. They will advocate, they will advise and encourage women to have their screening. So we know there is Dr. Google, you go on YouTube, you go on all of this TikTok, all of these handles. There's a lot out there. Ensure that we look for the right one, look for professional information that will guide you, that will support you, even if not you specifically or personally, your loved ones.
Thank you so much. So very, very important. We have to be mindful of the information that we are getting. Thank you so much, Lady T.
Yes.
Please, Lady T is here. If you would like to reach out to her, how can you be contacted? You can use Lady T if you like. She says she's available. If you want to have a women's talk, if you've invited your friends at home, wherever you're comfortable, to have these conversations. She's available, and she's a person in our community as well, and she reaches out to every community because that's her specialty. So please, how can you be contacted?
So you can go into info@canceruksalon.org, and the salon is SALONE.org, or you can go to Cancer UK Salon on Facebook. You can just inbox. We can pick it up from there. We'll send whatever information on the page, or you can go to www.canceruksalon.org. Again, go there. If you leave a message, we'll pick it up and we can respond to all of your concerns and your messages.
Okay, I was just sending it. Yeah. So please, if you need Lady T personally, contact me. And she's also on social media. You can reach out to her directly. Again, we are not stopping. We are going to continue. I'm not saying this because I've lost family members, but I know a lot of us, we've lost our loved ones. Even if not for cervical, but to various,
Well,
manners
some of us don't
of
even
diseases.
know,
Yeah.
because until we found ourselves in advanced world, especially for our sisters from ethnic or low-income countries, don't know what their loved ones died of. They just, or they had problems down below or whatever it is. But this is our chance, it's our opportunity. And what we're doing is that if we don't know what our families had, at least we create that opportunity for our children to know what their mothers had, which they could be more conscious about, ensure that they prevent it for your children and your grandchildren as well. So most of the time, people don't know what their loved ones, their mothers or their grandmothers, because then probably they're too old or they were not in advanced areas where they got diagnosed. If you're in opportunity to be in such countries, advanced countries, when you get invited to have cervical screening done, please, even if you're not doing it for yourself, you're doing it for your generation, because they know and they can take precaution on that.
Wow. Thank you so much. Knowledge is power. My people are perishing because
of lack of knowledge.
Lack of knowledge.
Or not here, you have all the knowledge here if you listen.
Yeah. So please, that's why we're out here. We are sacrificing our time to come. We are not paid for this, but we want to inspire. We want to empower.
I'm
We
looking for
want to
someone to pay me.
educate.
That'll be a lot of money, huh? There's a lot of work for that, but it's passion.
Exactly.
It's passion, and I enjoy doing it. And
Thank you.
professional is to give back and knowing the gaps that's in our system. Because even where you have the most advanced treatment, advanced system, these are the gaps, the information, having locals talk about things that will affect them, as opposed to just go on NHS websites or, call your GP, where you'll be on the line, you are caller number 10. Please hold. Or if you drop your phone, we'll call you back. You'll be waiting for that call. It's very annoying. But if you know there are people, around your community who've got the knowledge, not just people, organizations around that you can reach out to, please do that.
Yeah.
Because, everything is out there, but how you access it.
This is what matters.
That's what matters, and that's what really pivotal that we need to look at.
Wow. Wow, wow, wow. Thank you so much, Lady T. I think I'm gonna be bringing you back. We're gonna keep pushing. We're gonna be pushing, and even we're just talking about next month, where only I'm not sure we can even lay tabs on it, but there is just so many different types of this disease, like you said, we don't know about, and we need to talk about these things so that if it's affecting you or your loved one, you know what to do. Please, let's not suffer alone.
And 4th of February is World Cancer Day. So we all, take the responsibility to take care of our health. If your friend, your sister, or somebody you know have received a screening invitation, encourage them to go, because they're afraid of the unknown and what it could be. Encourage them to go. If you have the time, go with them. That's part of the support you can give them. Because if everything is fine, then they're happy. They can carry on their normal lives. But then if they just stay, they're scared and they don't go, if there's something wrong, by the time you get it done, then it would have gone too far. So please, let's take it as a personal commitment to support our friends, not just in terms of cervical cancer. 4th of February is World Cancer Day. Let's all come together and support our loved ones. Even if you have a friend who hasn't, they've got cancer, you haven't had time to visit them, please visit them. Visit them and, support, because psychosocial support is very important. Having people often around you is very important as well. You have the pharmaceutical medication, but our social medicine as Black people,
it's powerful.
It's powerful. Religious one is powerful. Whether you're Muslim, you're Christian, or whatever denomination or whatever religion you are, that you believe in, if you got
need a community.
That's very important as well. It's powerful. So please talk to people, reach out, and I believe whoever you reach out will respond positively.
Wow, thank you so much, Lady T. It's really been an absolute pleasure to have you on here. I'm so happy that you made time not only for me, but for my viewers and for many other people who have joined us. We don't know how far this awareness we've created today, we don't know how far it's going to be traveling, so I'm really glad that we've really done it. You've done it. You've done this presentation. You've spoken from your heart. You've spoken with passion. And I pray that, the Lord will continue to use you, open doors to reach many, many women, many families. This is everything that everybody needs to be aware of. Men need to be aware of these things so that they can show better support to their wives, brothers, to their sisters. If you're a man and a female family member is going through this, how can you support them? Because sometimes the men don't know how to deal with these things. So this is an education for everybody. For everybody.
So another thing is that for those who did not have the opportunity to watch live, they can always click on the link and they can follow up and can watch that as well. So it doesn't mean because you've missed it today, you cannot follow up and all that. You can still go and drop a line, a comment that Floris will look at. If there's anything that she needs to draw to my attention, she'll forward to me. I'll definitely come to the, I'll try to follow up the link as well to see if there are any questions for me that I can respond to. So please go back on the line and watch the program, ask your questions, reach out. We're here to help.
Thank you so much. She just spoke. She said it all. She's here to help. So please, if you've not watched this, it's all on there. It's also on my Facebook platforms. Practical Talk is also on my personal platform, and I've shared Tina as well into that. So you'll be able to see her and you'll be able to follow the amazing work that she does. She does a lot behind the scenes and openly. So you'll be able to actually see what she does. Yeah. So thank you so much for your time with us. You started you started with us. I'm like, this year, no, I have to start. Again, our health is so important because I needed to work on mine. Thank God I'm able to be here today because when I had my own scares, I had to go and work on them. So thank you so much, Lady T. And we want to say thank you to everyone who have joined us today. Please share this video and continue to empower others. Also subscribe to my channel and support the work that I do if it's been a blessing and an encouragement to you. And for anybody who is going through this, as we have had this discussion today, we send you our hugs. And as you're doing what you need to do physically, medically, I also pray for you that you will receive your healing by God's special grace, and you'll be able to be back on your feet. Please do not give up. May you be strengthened on every side. May you receive help and support, like we're talking about support from every side. Amen. Thank you so much, Lady T, for your time with us. What's one last thing you want to say?
And love from hot Sierra Leone. In the UK, you're in the cold weather. I'm so sorry, but hey,
and I'm so grateful.
A few more days before I come back. So
I'm so grateful. You see, she's all the way from Sierra Leone. I have to steal at least this time from her. Enjoy the hot weather, and I'm so grateful that we didn't have any challenges today.
No power.
Thank you.
My laptop is charged. I have my internet, so
this message needed to go through.
Yes.
Thank you so much. Thank you so much, viewers. Have a lovely evening wherever you're joining us. If it's a day, have a lovely day. If it's in the morning, then have a lovely morning. Thank you so much, everyone. Bye for now.